Aloha, I'm Dr. Taketa-Wong. Thank you for joining me. Up until recent times, if you were under the age of 50, you didn't have to worry much about cancer. That is no longer the case. Early onset colon cancer in that age group has skyrocketed by 63% since 1990. Cancer is a serious diagnosis at any age, but when it strikes younger adults, the tumors are typically more aggressive. They can also go undetected longer because routine cancer screening isn't recommended for some of the most common cancer types, such as breast and prostate, typically until at least age 40 or 50. Since cancer is typically set in motion 20 or 30 years before it's diagnosed, researchers wanted to know what changes could have caused this dramatic increase. Medical researchers have determined that increases in early onset cancer correlate with societal changes that started in the 1950s. These include a huge increase in processed and fast food, less physical activity, and environmental toxins like pesticides, plastics, and household chemicals. These changes accounted for the startling increase in early onset cancers that started in the 1990s. Their effects would have taken about that much time to accumulate. Let's begin with a few facts. What is cancer? All of the cells in our body have a lifespan. They're supposed to exist for a certain amount of time, die, and be replaced by new cells. Some cells and others for several years. With cancer, the cells become mutated. The part that's supposed to tell the cells to die gets turned off, and they keep living and growing while ceasing to perform their normal job. For example, white blood cells are supposed to fight off infections, but with leukemia, which is a cancer of the white blood cells, they keep multiplying, but they're not fighting infections anymore. And if they continue to grow, they can form into tumors. As it stands now, 40% of Americans will be diagnosed with cancer in their lifetimes. That's 136 million individuals, moms, dads, sisters, brothers, relatives. Each year, close to 2 million people are diagnosed with cancer and nearly 620,000 die from it. In fact, most of us know someone, perhaps in our own family, who has had cancer. I'm going to read through the list of risks for early onset cancer affecting people 50 years old and younger, and then talk with you about some keys to prevention. The risks include unhealthy foods and beverages, less physical activity and a more sedentary lifestyle, lower breastfeeding rates, increased alcohol consumption, reduced sleep among children due to bright lights during the night shift work, reproductive changes, including reduced age of puberty and increased contraceptive use, increased rates of type 2 diabetes, and higher antibiotic use. Now, as you're viewing this and want to talk with me about a health condition, just call or text our office to schedule a no-charge phone consultation. There's no charge because we don't take new patients without talking to them first to make sure that what we do fits their needs. We are still taking new patients, and you'll find all the contact information on our Facebook page. And please remember to visit our online supplement store, which is on our website at drtaketa-wong.com. That's drtaketa-wong.com. Our prices are very competitive, and the proceeds go to helping children with special needs with their medical treatment. A link is in the post with this video. It's clear that when it comes to cancer, we are our own worst enemy and our own best friend. Most of the skyrocketing cancer numbers for younger adults can be traced back to preventable causes and can be addressed by changes in our own behavior. So now let's turn to preventing cancer, because with most diseases, but especially with cancer, prevention beats treatment every single time. There are some accepted general guidelines for cancer prevention. The general guidelines include eating anti-cancer foods, getting sufficient exercise, having good quality sleep, and lots of the fruits and vegetables, especially vegetables, are high in antioxidants, carotenoids, and polyphenols. These are essentially compounds found in food that have tumor-fighting properties. For example, apples are high in polyphenols. Berries are high in antioxidants. Carrots are high in carotenoids. There's also a compound called sulforaphane that decreases the growth of cancer cells, and that is found in the cruciferous vegetables like broccoli, cauliflower, kale, and so on. One of the best sources is broccoli sprouts, which is a better source of sulforaphane than adult broccoli or other sprouts. Sulforaphane also helps to increase glutathione levels, and glutathione is one of the main antioxidants in our body. It helps to decrease inflammation and binds with toxins so they can be removed through the waste. Cancer risk is increased with higher levels of inflammation and toxicity. So having an antioxidant like sulforaphane that decreases inflammation and gets toxins out of our body makes sense to help to decrease cancer risk. Fatty fish like salmon, mackerel, and anchovies can help to reduce the risk of colon and prostate cancer. The American Institute for Cancer Research has found that all nuts have cancer-preventing properties. Walnuts in particular were found to be helpful in reducing the risk of breast cancer. Legumes such as lentils, beans, peas, and so on help to reduce the risk of both colon and breast cancer. How about exercise? There are 13 different types of cancer whose risk is lessened because of regular exercise. These include breast, prostate, colon, lung, uterine cancer, and more. Also, if people have cancer already, exercise assists in recovery and increases the likelihood of survival. It can also play an important part in improving overall physical and mental well-being. In addition, cancer can decrease, or exercise very likely makes anti-cancer treatments more effective in destroying cancer cells. It can also improve sleep. A vitamin D deficiency is another risk factor for cancer. So a really simple thing is to get your vitamin D levels tested. You can ask your doctor for a blood test, and I like to see the level at 50 to 80 nanograms per milliliter. If it's lower than that, you should consider taking a vitamin D supplement. When it comes to alcohol, the American Cancer Society guidelines state that it's best not to drink at all, and definitely no more than 1 drink a day for women and 2 for men. By the way, if you're looking for resveratrol, you don't need wine. And it's in red grapes, grape juice, cocoa, and all kinds of berries. Lastly, although I mentioned it in the list of risks, I want to emphasize how very important getting good, sound sleep is. That means 7 to 8 hours every night. And trying to sleep more on the weekends doesn't make up for missing sleep during the week in terms of repairing the body, decreasing cancer risk, and other important functions. What's important to take away from our time together is that early onset cancer is serious and on the rise, but it can be prevented by. I'd certainly welcome the opportunity to discuss your specific health situation so you too can feel empowered with your health. To do so, just call or text our office to schedule a no-charge phone consultation with me. All of the contact information is on our Facebook page. If you purchase supplements, please consider visiting our online supplement store, which is on our website at drtaketa-wong.com. That's drtaketa-wong.com. Our prices are competitive, and the proceeds go to helping children with special needs with their medical treatment. A link is in the post with this video. Mahalo, and I look forward to seeing you in another 2 weeks. Aloha.